Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about the child's foot. I get so many questions from parents wondering if their children are developing properly, if their feet are developing like they're supposed to, and so forth. So I want to give you a little bit of background, a little bit of information about the child's foot. The development of the child's foot starts early on. It starts in the 4th and 5th week of gestation, so really early on in development. And by the 7th week, they're segmenting and so forth. And is largely complete as far as forming by the 8th week after conception. So really early on, you've already got the feet and the hands developed from the limb buds that form over that period of time. That being said, at birth, most of the time, most of the bones are not ossified. Many of the bones are developing over this time and they're cartilage instead. And so they're developing over a period of years. In girls, for example, the foot will often stop growing somewhere between 11 and 14 years old. And in boys, it's usually between 14 and 16 years old where the foot can stop growing, or at least many of the growth plates will close. So with that understanding, there's a couple of other things we just think about with a child's foot. In child's foot, if you look at a child's foot, the proportions are usually different. The feet are usually shorter. They can be anywhere from 7 to 8 centimeters in length, not very long in the full-term average child. The rear portion of the foot is not as long as it will be over time. The calcaneus, or the heel bone, will actually lengthen, so that in adults, about 50% of the foot is made up of the tarsus, or the tarsal bones, the back portion of the foot bones, and the metatarsals and toes are the other 50%, whereas in a child, the metatarsals and toes are usually nearly 60% instead of the 50% that they become as adults. Why does that matter? Informational. It actually gives you a little bit of information, because you'll also notice a lot of times in an infant, they have a wider forefoot, wider up near the toes, and it's thinner heel, and they're also really flat. Most infants have a really flat foot. That doesn't mean that they have a true flat foot like they would if they were an adult, and some of them will start to form an arch, but they have a brown fat in that area, infant fat, that will often be in the arch that makes it so you have a flat foot. So development-wise, what do you expect? How should the foot be developing, or how should the child be developing? We've talked about this before, but a lot of times when a child's born, their feet are completely turned out, and then you'll get rotation in, then rotation out, then rotation straight over a 2 to 5 year period. And so they're actually changing over that period of time. Because of that, sometimes in an infant that has a pigeon-toed, we're less worried about it, and we're actually watching to see how the foot is continuing to develop, as opposed to having to treat it aggressively. That being said, there are certain deformities that we treat right off the bat because they're easier to treat before the bones are formed, such as a clubfoot or some of those type of situations. Standing, typically, as I was talking about shoes and children's in shoes, a lot of times it's important that we allow the children to stand barefoot, that we don't use a shoe to allow the intrinsic muscles, the small muscles inside the foot, to start to learn to function like they're supposed to and get more appropriate without the additional support or significant support that can happen in the feet. So the idea is we are very aggressive at looking at children's feet if they never want to walk. If they're getting to 11, 12, 13, 14 months and they seem to not want to walk, or if they're having significant pain and they'll walk for a little bit of time and then they want to be carried, again, we start saying, okay, what's going on? Are there things that we should be doing? The goal here being that we're looking for treatment options or ways to actually help the child's foot develop appropriately so that the parents don't have to worry. So if you have a child and you're not sure if their feet are developing like they're supposed to, then you can definitely have them be looked at, and you can say, okay, is this normal development? And there are multiple things we're looking at. The shape of the foot, the arch area, the torsion of the legs. Are the feet turned out, turned in, straight, those kind of things. And over time, we start to look at the development of the bones as well. Because the children's feet are developing, and they should develop at a certain rate, but they should also not be painful. Growth should not hurt. Growing should not hurt. So if there's issues with pain, there's usually something that could be done to treat it. This is Dr. Brandt Gibson, and this is your Podiatry Tips, day 93.